So today we will discuss about the toxicology, the introductory part. Okay. What is toxicology? Toxicology is the science dealing with properties, action, toxicity, fatal dose, detection, estimation, interpretation of the results of toxicological analysis and management of poison. And what is forensic toxicology? It is a branch of forensic medicine dealing with medical and legal aspect of the harmful effect of chemical on human beings. So that's the difference between the toxicology and forensic toxicology. Now, what is clinical toxicology? It deals with human diseases caused by or associated with abnormal exposure to chemical substances. And what is toxinology? Toxinology refers to the toxin produced by living organisms which are dangerous to man. For example, snake, fungal and bacterial toxins. And what is poison? Any substance which when administered in living body through any route, that is inhalation, injection, surface absorption, will produce ill health or death by its action, which is due to its physical, chemical or physiological properties. For example, sulfose, sulfuric acid, arsenic, etc. Now, what is a drug? That is defined by WHO, World Health Organization. Drug is any substance or product that is used or intended to be used to modify or explore physiological systems or pathological states for the benefits of recipient. For example, paracetamol, ciprofloxacin, salbutamol, estrogen, etc. etc. Now, what is fatal dose of a drug? Fatal dose of a drug or a poison is also known as LD50, lethal dose 50, amount of drug that would kill 50% of a test population. What is toxicity? The therapeutic index or the ratio of toxic to the effective dose of drug that indicates the relative toxicity of drugs. Now, this is a table by Guzlin et al. Toxicity rating, like probable, which depends on probable oral lethal dose and what is its rating. So, if the probable oral lethal dose is less than 5 mg per kg, then the rating is 6. That is super toxic, and it is in decreasing manner. Like if the lethal dose is 5 to 50 mg per kg, then the rating is 5. If it is 50 to 500 milligram per kilogram, then the rating is 4. That is very toxic. 0.5 to 5 gram per kilogram, 3, moderately toxic. And 5 to 15 gram per kilogram, 2, slightly toxic. And greater than 15 gram per kilogram, it is non-toxic. Now, what are the various laws and acts which are formed on poison? The first, the Drug and the Cosmetic Act 1940. It regulates import, manufacture, distribution and sale of all kinds of drugs. Its main feature is to control purity, quality and strength of a drug. Now, the Drug and Cosmetic Rules 1945. It was framed to regulate the importation of drugs, functions and procedures of Central Drugs Laboratory, appointment of licensing authorities and the manufacture, distribution and sale of drugs. Now, the rules have classified drugs into schedule as follows. That is very important table. You may get an MCQ from this. Schedule C, biological and special products. Schedule E, poisonous substance. In Schedule F, we have vaccines, antisera and diagnostic antigens. Schedule G, hormone preparations. Schedule H, prescription drugs. Schedule J, list of diseases for which the cure of which no drug should be advertised. And Schedule L, antibiotics, antihistaminics and other recent chemotherapeutic agents. Now, some special point about Schedule G and Schedule H drugs are: Schedule G drug label must display the text, caution, it is dangerous to take this preparation except under medical supervision. And Schedule H, the drug label must display the text RX, that is take thou off, and the Schedule H drug warning, to be sold by retail on the prescription of a registered medical practitioner only. The Pharmacy Act 1948. The object of this act is to allow only registered pharmacists to compound, prepare and dispense medicine on the prescription of a medical practitioner. The Drug Control Act 1950. It provides for sale, supply and distribution of drugs. It gives power to fix the maximum price of any drug, which may be charged by a dealer or producer. The Drug and Magic Remedies Objectionable Advertisement Act 1954. The object of this act is to prevent self-medication and treatment which causes harmful effects. The Narcotics, Drugs and the Psychotropic Substance Act. A psychotropic drug is one that alters mental function by its actions. Example LSD, amphetamine, barbiturates, etc. And a narcotic drug means it causes dullness of senses and induces sleep. Example cannabis, opium and cocaine. So the law prohibits cultivation, manufacture, possession, sale, purchase, import and export etc. of these drugs except for medical and scientific purpose. Now, what are the medico-legal aspects of poison? Section 85 of the IPC. It says that act of a person incapable of judgment by reason of intoxication caused against his will. That is, nothing is an offense which is done by a person who at the time of doing it is by reason of intoxication incapable of knowing the nature of the act or that he is doing what is either wrong or contrary to law, provided that the thing which intoxicated him was administered to him without his knowledge or against his will. So it's a very complicated language, the language of law. So I will simplify it. For example, A administers bhang to B without his knowledge by mixing it in doodh or milk and like that. B murders C under the effect of bhang. B is not responsible. Section 272-278 IPC deals with the adulterated food and drugs, out of which these two are important. Section 274 of IPC, adulteration of drug is punishable with imprisonment up to 6 months or 1,000 rupees or fine or both. And Section 275 of the IPC, sale of adulterated drug is punishable with imprisonment up to 6 months or 1,000 rupees fine or both. Now, the Section 284 of the IPC, it deals with the negligent conduct with respect to poisonous substance. Whoever does with any poisonous substance any act in a manner so rash or negligent as to endanger human life or to be likely to cause hurt or injury to any person or knowingly or negligently omits to take such order with any poisonous substance in his possession as is sufficient to guard against any probable danger to human life from such poisonous substance shall be punished with imprisonment of either description for a term which may extend to 6 months or with fine which may extend to 1,000 rupees or with both. For example, housemaid leaves rat killer accidentally on a table. Young child eats it believing it's a chocolate. Housemaid can be sued under Section 284 IPC. Now, Section 328 IPC, it says causing hurt by means of poison with intent to commit an offense. So, whoever administers to or causes to be taken by any person any poison or any stupefying, intoxicating or unwholesome drug or other thing with intent to cause hurt to such person or with intent to commit or to facilitate the commission of an offense or knowing it to be likely that he will thereby cause hurt shall be punished with imprisonment of either description for a term which may extend to 10 years and shall also be liable to fine. Now, we will discuss about the nature of poisoning. There are many natures of poisoning. The first is homicidal and the second is suicidal. So there is a table of differentiation between this which is very useful, like characteristics of an ideal homicidal poison and an ideal suicidal poison. An ideal homicidal poison should be colorless, odorless and tasteless, and it should be easily soluble in any drink or food without causing any obvious change, because if it causes any change in the taste or smell or color of the food, then it would not be ideal homicidal poison. And it should resemble a natural disease, that is clinical diagnosis should be difficult, so that the person who has tried to homicide this should be safe. So an ideal suicidal poison, it can be of any color, any odor, any taste, but it should cause a painless death. Now, The onset of signs and symptoms should be very low in ideal homicidal poison so that the person may escape. And the fatal dose should be low. And that means the toxicity should be high. It should be super toxic or highly toxic. No, and the fatal period has no particular requirement. But if it is short, then the person who has taken the poison should not left with any treatment. Should not have any time to get any treatment. There should not be any antidote available. It should not be detectable by any lab test or any test. And it should have a quick metabolism. It should disappear after causing death. And it should produce no post-mortem changes. And for ideal suicidal poison, the onset of symptoms should be quick and the fatal period should be very less, and there are no such requirement for any other things. Now, example of an ideal homicidal poison is organic compounds of fluorine used as rodenticides and thallium. It has many properties of an ideal homicidal poison. There is not any ideal homicidal poison, but the organic compounds of fluorine and thallium, it come close to ideal homicidal poison. And ideal suicidal poison is opium and barbiturates. But the most commonly used homicidal poisons are arsenic and aconite, and the suicidal poisoners which are most commonly used are organophosphorus compounds and andrin. Now the third type of nature of poisoning is parasuicide or pseudocide. It refers to suicide attempts or gesture or self-harm where there is no actual intention to die. For example, taking a few sleeping pills so that the parents recognize get their attention and like that. Accidental poisoning. Household poisons accidentally consumed by mistake for harmless substances, gas leak accidents like Bhopal gas tragedy, food poisoning, insect bites, etc. etc. Stupefying poisons. Used to knock out travelers for robbery or women for sexual assault. Example, cannabis, chloral hydrate, datura, etc. Abortion. Substances that causes irritation of uterus, causing it to contract. Examples of these are aconite, arsenic, calotropis, croton, ergot, lead, mercury, potassium permanganate, etc. Aphrodisiacs. Substance that increases sexual desire. For example, arsenic, cannabis, cocaine, opium, strychnine. Arrow poison. These are used at the tip of arrows for hunting and to kill enemies. An ideal arrow poison must be poisonous parenterally but safe or orally so that the animal can be consumed after it has been killed. Example are plant-based, Abrus precatorius, aconite, calotropis, croton oil, curare, trophanthus, strychnine, and animal-based is batrachotoxin, BTX. Now, cattle poison. It is used to kill cattle of enemies or to obtain hide. Example is Abrus precatorius, aconite, arsenic, calotropis, nitrates, oleander, organophosphorus compounds, strychnine, zinc phosphide. Aphrodisiacs. Substance that increases sexual desire. For example, arsenic, cannabis, cocaine, opium, strychnine. Arrow poison. These are used at the tip of arrows for hunting and to kill enemies. An ideal arrow poison must be poisonous parenterally but safe or orally so that the animal can be consumed after it has been killed. Example are plant-based, Abrus precatorius, aconite, calotropis, croton oil, curare, trophanthus, strychnine, and animal-based is batrachotoxin, BTX. Now, cattle poison. It is used to kill cattle of enemies or to obtain hide. Example is Abrus precatorius, aconite, arsenic, calotropis, nitrates, oleander, organophosphorus compounds, strychnine, zinc phosphide.